Good day friends, today I am going to talk to you about the corpus luteal cyst. What is corpus luteum and how do we see it? How does it look on ultrasound? This is a patient with around 7 weeks of pregnancy. You can see that the fetal pole is seen over here and the CRL is around 10.57, measuring 7 weeks 5 days. And you can see that the heart rate in this patient is around 113 beats per minute. Initially in the pregnancy the heart rate is low. As the pregnancy advances the heart rate starts increasing. This is the, you can see the heart beating over here. This is you kindly focus it. You can see the heart beating over here, and this is the yolk sac and this is the fetal pole. And if you see carefully that the cystic structure over here, we see better in the other view. You can see that there is a cystic structure over here. There is a thick walled cyst. This is the corpus luteal cyst in the right ovary, and you can see that it is a very thick walled cyst, and the inner margins are crenated. And this is the classical corpus luteal cyst in the right ovary. The corpus luteal cyst is the remnant of the follicle which has developed and ovulated. Normally the follicle size at the time of ovulation is 18 to 20 millimeters, and as the ovum is expelled by the ovary into the fallopian tube, the cyst starts increasing in size, and it is an endocrine structure, and it releases estrogens and progesterones and helps in the implantation of the fertilized egg. If the pregnancy is conceived and then the corpus luteal cyst keeps on increasing in size. Normally it is 2 centimeters at the beginning, but it increases to up to 5 centimeters in size up to 10 weeks of pregnancy. Beyond 10 weeks of pregnancy it starts decreasing in size, and by 15 weeks it disappears. And the characteristic of the corpus luteal cyst is that it is a thick walled cyst, and it has a ring of fire around it. You can see that it is a highly vascular cyst, and sometimes the ring of fire may not be seen on routine color Doppler, and so the power Doppler might be required. But there is a ring of fire around the cyst, and the cyst walls are thick and the inner margins of the cyst are crenated. So if you find this sort of a cyst, then it is called as a corpus luteal cyst, and it indicates that the conception has occurred and the pregnancy is there. And it should be visible up to 10 weeks of pregnancy, and it should disappear by 15 weeks of pregnancy. Sometimes the cyst may not be visible in the pregnancy. Does not mean that the corpus luteal cyst was not there, but if it is visible, then one should be able to demonstrate the ring of fire. I hope by this video you have been able to understand what is corpus luteal cyst, how does it appear on ultrasound examination. It is usually seen on one side of the in one ovary only. And if you like our videos, please subscribe to our channel, share the video to a large number of people so that maximum number of people can be benefited. Thank you very much.